Hello everybody, I'm Hunter's dad. Hunter is my 8-year-old autistic boy. And I'm coming to you with another topic on childhood mental illness. Today I thought I would take on the most contentious topic, which is medication in children. This is a topic that I found to be the most controversial. Whenever I have discussions with parents or listen in on discussions, I notice that there's a high level of emotional feeling in this topic. I'd like to start out by discussing a major study. It was called the Multimodal Treatment of Attention Deficit Disorder. And it was published in 1999 in the Archives of General Psychiatry. It's commonly referred to as the MTA study, Multimodal Treatment of ADD, and many papers have come out of it. What I'm going to talk about is the original publication of the results of this study. The reason I'm choosing this is the most well-designed, longest, and largest study of medication in children. This is what the study group did in the MTA study. They took about 750 children and they randomly assigned them to 4 different treatments. One treatment was usual care. In other words, there was no intervention done. And these were children who were being taken care of in the community by their pediatricians. And many of them, about 3/4 of them, were on medication. The second group was intensive behavioral intervention. That is, they received very intensive psychosocial and behavioral intervention. I'll talk about that in a minute. The third group was medication management. And in this case, the experts in medication management designed individualized, carefully titrated medical regimens for the children. Most of this ended up being Ritalin, and a smaller percentage were other medications for ADD, such as Adderall. And then the fourth group was psychosocial intervention plus medication. So just to go over these 4 groups again: no intervention, usual care, intensive behavioral intervention, medication, specialized medication intervention, and both behavioral and medication intervention. Just to give you an idea, the behavioral intervention was very intensive. It involved a summer camp for the children. It involved special classes for parents. It involved consultation for teachers and special tutoring for the children. And this study takes place over a 14-month period. And many, many different outcomes were measured by multiple observers. And the study was designed to answer 3 questions. Question number 1 was, do medications and behavioral treatments lead to similar outcomes? In other words, is behavioral treatment just as good as medication treatment? The answer to that question was no. Medication treatment was better than behavioral treatment. Question number 2 was combined treatment, medication and behavioral treatment, superior to medical management. And this was the most controversial finding. In other words, should we be giving children medicine and behavioral intervention, or is it good enough just to give medical intervention? And the answer, surprisingly, was that that the combined treatment was not superior on the core measures of attention deficit disorder. In other words, when you looked at hyperactivity, inattention, and impulsiveness, medication management was just as good as medication management plus intensive behavioral intervention. So the most controversial finding of this study is that actually medications were the most useful intervention for children with attention deficit disorder. Although behavioral intervention did not treat inattention, impulsiveness, and hyperactivity, it did seem to offer a very modest advantage in terms of social skills, things like getting along with the parents, feeling greater self-esteem, feeling less depression, and getting along with the parents. So what practical advice can parents take home from this study? And I would say there are several. One is that you need to realize that if you want to treat the core symptoms of ADD, you're going to have to use medication. In other words, you're not going to be able to train your child to pay attention and to be less hyperactive. It just doesn't work. And in that arena, medication does the heavy lifting. point number 2 that it tells us is that carefully designed medication management by experts is superior to medication given in the community by pediatricians. Practical take-home message number 3 would be that psychosocial interventions can have a small effect on things like social skills and the child improving in terms of getting along with others and with self-esteem and psychiatric issues. But it's important to keep in mind that even very intensive psychosocial intervention had only a modest effect in these arenas. Does this study tell us that we should be using medication on children? Not necessarily. What this study told us is that, at least in this one arena, in attention deficit disorder, medications worked. That's separate from the question of whether we should use medication because, for example, this study did not address the potential long-term harm from medication. It left that question unanswered. The reason that I brought up this study is that it's a very important study, and it's the largest study of medication in children, and it did show that medication worked. And once again, that's called the multimodal treatment of attention deficit disorder, otherwise known as the MTA study. It was started in the early 90s, and the first report of the results were published in 1999 in the Archives of General Psychiatry. This is a widely discussed study, and any discussion of attention deficit disorder treatment should include a knowledge of this study. Okay, everybody, I hope that helps somewhat. I'm going to have more discussions about medication treatment of childhood disorders in future topics. Okay, everybody, be well, and I'll see you next time.